my name is Kira Janarowski, and today I'm going to be discussing sharks' role in medicine. And so as per our last presentation, I discussed gnathosomes, which are jawed vertebrates, and specifically the class Chondrichthyes, which classifies the jawed cartilaginous fishes. Sharks do fall underneath this, and I was really interested in discovering or looking at medical research that had to do with sharks. And so while I was on the hunt for this, I had come across this article that had discussed black fever, also known as visceral leishmaniasis, which affects a person's spleen, liver, and bone marrow. And there's currently some medications to fight against this condition, but if it's left untreated, it can be fatal. And so visceral leishmaniasis is a common problem in the Mediterranean region, and there's currently no vaccine against this disease. And so it's really important that there are treatments, and so chemotherapy and drugs are specifically relied on. But recently, they've been discovering that drugs have shown serious side effects, and the body, while infected with black fever, has shown drug resistance. So with the traditional treatment, the TH1 cells that secrete the essential cytokine to control this condition are not always functioning properly. And so this is what sparked the investigation. It just deemed itself necessary to develop new anti-lethal treatments. And so this is where the shark's role came into play. Sharks have been recognized largely within the medical community for its triggering of immune response. It's been used within cancer treatment, joint lubricant, treatment of psoriasis, diabetic research and treatment. And this is because it contains several chemicals such as proteins and glycoproteins. And so, as I mentioned earlier, the TH1 cells are not always functioning properly with the use of the traditional visceral leishmaniasis treatment, and the TH1 cells are really important for the body's parasite-specific cellular immune response. And so, this study was conducted to analyze how shark's cartilage extract and the biochemicals that come from it could be used alone or while paired with a traditional treatment in the effective treatment of visceral leishmaniasis. And so later on, they're going to be analyzing, after completing this, they're going to be analyzing the IFN gammas and the IL-4 patterns in this, and also the parasitic present with this condition. And so within this experiment, they had 100 female mice. They were randomly divided into two groups, and so 20 mice were kept as negative control, 10 uninfected and untreated, and then 10 uninfected but administered the shark extract to see how the shark extract affected the mice's body. And then there was 20 mice who were kept as a positive control, they were infected but they were untreated to see how this condition takes its normal course within a mice's body. And then there was 60 mice that were divided into groups of 10, each administered different treatments. So the first two groups were the traditional treatment. The third and fourth were, the third one was the artemisinin and glucantime, the traditional treatment, combined. And then it was the two traditional treatments individually combined with the shark cartilage, and then the two traditional treatments combined, and then also combined with the shark cartilage. And so the way they went about this was that they assigned their treatment for 28 days, and after 28 days, 5 mice from each group were killed to examine if this was working so far. And then after 11 weeks, the mice were analyzed, and there was data collected for the parasitic presence, and then the presence of the IFN gammas and the IL-4 present within the mice's body. And so they found that there was a reduction of parasites by all treatments. And specifically, they were really happy to find that the glucantime and shark cartilage extract combination caused the greatest reduction in parasite presence in comparison to all other treatments. But it's important to note that the artemisinin, which is a traditional treatment that has been used, did show a low reduction in parasite load in comparison to when it was used with the other treatments. So it shows that the traditional treatments are still effective. And as you can see here, if you look on the graph, the shark and glucantime present show a large increase in the IL-4, which is really important in the body's autoimmune response and antibody response. And so, as I mentioned earlier, the essential cytokine to control the visceral infection did have a higher presence when the glucantime and shark cartilage extract treatment was used. And as I mentioned, that the artemisinin alone is still effective. So in conclusion, the study was done to analyze the effects shark cartilage extract combined with the traditional treatments could have in the treatment of this visceral leishmaniasis. And the study concluded with the success for the researchers and a new discovery for treating this visceral leishmaniasis, as the combination of glucantime and shark cartilage extract do effectively treat this condition.